every baby is unique, and this is the same situation for how each child develops. But what if you feel something is amiss? Struggling to hit milestones, not smiling back, and not making eye contact could all be signs that something more is actually going on. Autism, also known as autism spectrum disorder, can be detected early in life, and recognizing the signs is crucial for timely intervention. In this video, we will explore the common early signs of autism in infants, including delayed speech development, social interaction difficulties, and repetitive behaviours. By understanding these signs, parents and caregivers can go to seek professional help and support to get the best possible outcome for their child. So, watch to learn more about the early signs of autism in infancy and how early detection can make a significant difference to a child's life. Hi all, ADHD Dad here. Now let me just clarify before I continue with this that I don't claim to be any expert except for the experience that I have for myself. I am a dad to an autistic child, as well as having ADHD and autism myself. If you believe that your child is having any of the symptoms listed, then please go and seek professional help. But without further delay, here are some of the signs to look out for in infancy. The first one being not making eye contact. Understand not all children on the spectrum will show the same symptoms, but not wanting to make eye contact or not showing prompts that they are listening to you, such as not responding to their name and making limited facial expressions, can be an early sign of autism in infancy. Eye contact usually starts to develop between 2 and 3 months, but it can be earlier or later depending on the child's development. A baby smile may start to happen around the 2 to 4 month mark, though if after 4 to 5 months still nothing has started to occur, then it may be something to start to keep a close eye on. Next sign to look out for is delayed development. This could include not starting to babble, physical delays such as not shuffling or crawling, which usually starts to occur around the 6th to 10th month mark, as well as a delay in fine motor skills such as grasping for bottles, cutlery and toys. Remember, each child does develop in their own time, but a delay in any of these areas could be something that needs to be brought up next time you see your health professional, or as in the UK, when your nurse or qualified midwife comes to the house, usually for aftercare for the child. The third sign is unusual reactions to sensory inputs. This could include lights, textures, sounds, and becoming fixated on moving or rotating objects. These can be some of the first signs as babies begin to try new foods, start having less time where they are sleeping, and more regular outings with their parents. Our fourth sign could be lack of gestures, and what I mean by this is things like pointing, waving, and trying to reach out to maybe try and communicate to their parents or caregivers. Usually around the 9 to 12 month mark is when a lot of these gestures start becoming noticeable, and it may be something to take notice of if they are not present after their first birthday. Now the last one is a little bit more of a common representation of what autism can involve, and that is stimming. Our son started to show signs of stimming around the 6 month mark. So again, it's something just to take notice of. So what is it we need to do if we spot some of these symptoms? Well, first could be by speaking to your aftercare team, or if not, make an appointment with your GP or get a referral through to a paediatrician, where usually further evaluation occurs. From our experience, from first visiting the GP, we were first referred to the ENT, also known as the ear, throat and nose clinic. This was purely to see if there was any problems first with his hearing, speech and balance. After the appointments and everything came back normal, this is then when we was referred onto the CDC, also known as the Child Development Centre of where we are located. And from there, we went through the process to actually then go and get a diagnosis of autism for our son. Hopefully this puts a little real world perspective in what you could expect, but every system is potentially different, and they may choose to go through a different process for yourself and your child. If this video helped understand the symptoms of autism in infancy, please like and subscribe the video and join a growing community around neurodivergence. And down in the comment section, put your own experience as well as questions so me and other people can try and answer and offer advice for you. Again though, I will just reiterate that please take it just as advice and seek professional help. Thank you for watching, and if you have made it this far, please just know you're doing the best you can as a parent.